Welcome to Dr. Chan's Minor Ailments Forum today. Today I just want to talk about a very common skin condition that I see a lot, especially during the summertime. Now I know that is October now and it's coming up to autumn, then winter, but it's probably worth talking about it. So next summer when you do notice a funny rash like that, you will know what it is. Okay, so the condition that I'm going to talk about today is called Pityriasis Versicolor. Pityriasis, the name is complicated, but the meaning, once you know what it means, it's easier for you to remember, and knowing that's actually a description of the presentation of a rash. So pityriasis on its own means the scaly rash that you see resembling brands. Okay, so versicolor in this case, for this particular skin condition, it means multicolored. So the usual presentation would be, for example, a young person come in, normally children, and they said, I've been swimming a lot recently and I've got a tan on my body, but I realized that there's a certain area on my back is not tanning, and in fact it looks like a rash. It's also happened on my chest, on my arms as well. And some people might say, actually I presented with a pinkish kind of rash, a little bit scaly, but I don't know what it is. It doesn't itch, it doesn't do anything, it's just been there for a while and I'm a bit concerned. So bottom line is pityriasis versicolor is not a serious skin condition. It's actually caused by a yeast infection. So let me give you a picture to show you how they actually present. They present in several different ways. With the name Versicolor, you'll know that they present in different colors sometimes. So this is a person who is, I hope you can see it alright, so it's kind of got lighter skin, and you can see that he's got a pinkish kind of rash on his back. It's quite widespread, and if you really look, they do look a bit scaly. Okay, so that's one type of presentation of this condition. Let me find you another picture of a person who's got darker skin, and I'll show you how they present slightly differently. So look, you can see that this person's got darker skin, and actually his rash is much lighter than the rest of his skin. So that's how they usually present, two different ways, but the range of color can go from pinkish to lighter than normal skin, or even a little bit coppery in color. So bottom line is, this condition is common. It's a fungal infection that sometimes if you don't do anything with it, it'll go away on its own after a few months, up to a year anyway. And it generally has no symptoms apart from it looks a little bit unsightly. And if you feel that the situation is getting a bit bad and spreading to other places, then you can go and see your GPs to see whether you can get some antifungal cream to put on the area. It can take several months for the discolored patch to come back to normal, so don't get alarmed that you use the cream for a week or so and the rash is still there. And sometimes when the situation persists or become widespread, then sometimes your GP might offer you to have antifungal tablets. But saying that antifungal tablets can have quite a lot of unwanted side effects, and it can potentially affect your liver function if you take it for too long a time. So I would recommend that if you can use a cream, stay with the cream and only use a tablet if you really need to. Bottom line is, if you worry about a rash, go and see your GPs and get it diagnosed. But if you got a diagnosis of pityriasis versicolor, you can rest assured that this is a common yet benign condition. So I hope that the information is useful for you, and stay tuned. There'll be more information for you down the line regarding other conditions, not just skin. Alright, take care for now. Bye bye.